Professor, first and foremost, thank you for the introduction. Reverend Fathers, distinguished guests, I take special pride in my participating, and of course many thanks go to the Ecumenical Patriarchate, to His Eminence of Rhodes, and of course Father Stavros Kofinas. I was delighted to listen to Father Dimitrios Linos during the previous session. I have worked with Professor Linos. So, I will discuss the elderly and the future of the homes for the aging. This is a huge subject, of course. The presentation will be available. I will send it to you. You don't have to take notes. Let's make sure that we have time left for questions and answers. If we can show the presentation, my PowerPoint on the screen.
Last man.
Για να μην χάνουμε χρόνο μέχρι ότου.
Let us not waste any more time until the technical issue is addressed. Let me start by saying the following. Once upon a time, as you will see on the chart I will show, when we discussed demographics, we used to speak about pyramids. The base was births, and then as you would go up, the population would shrink because of pandemics, epidemics, diseases, etc. So very few were those who could reach old age. There were so few third age people that chances were that science would not really decide to deal with the needs of this age group. After the Second World War, in developed societies, we witnessed the following. Quality of life improved, diet improved, medicine and medication improved, resulting in longer life expectancy, which led to people simply living longer years. Another contributing factor was that births started shrinking. Again, once upon a time, families bore 5, 6, 7 children or more. As time went by, and especially after the Second World War, this started changing. So we were faced with lower and lower birth rates. Each couple in the past would leave at least 2 descendants. This would stabilize the population from a demographic point of view. Now, if this number goes below 2, more often than not to 1, then our societies, our populations start to shrink. So lower birth rates result in a shrinking domestic population, and then at the same time the group of the third age is increasing. I'll show you that on the screen later. Again, all this led to a chain of political, economic, and social, even health-related developments. We're now talking about a population with different particular features. We have pensioners, retired who do not work anymore, citizens. Thank you very much. We have the presentation on the screen now. This is the proverbial pyramid. After the Second World War, you see here life expectancy going up. You see here that in certain regions, the darker ones, life expectancy reaches 90 years. This is the Greek population. We're not talking about a pyramid anymore. This is the result of low birth rate and higher life expectancy. More and more people reach the third age. Here is the information, or the projection rather, about 2050. Mushroom. You see the US society where the third age proliferates. You see here the age groups. The third age increases faster than any other group. So let us see what aging really means. A living creature is born, matures, and then aging starts. What is this all about? This is a multifaceted, complex process during which we lose anatomical and functional properties, which leads to ultimate incompatibility with life. It looks like a Jenga game. Yes, it's exactly like that. We lose various functionalities until the tower doesn't stand anymore. There are external implications. We know about shrinks, about gray hair, etc. I will not take more of your time on this, but what about functionality? What about our functions? How do we change internally? Muscle mass shrinks, body water also shrinks, our bones, as we will see later, start to suffer from osteoporosis. They're not as solid and compact as they used to be. So yes, we do change. Aging, is it a disease? Let me clarify that. No, it is not a disease. It is a natural process that develops at different speeds from one individual to another, from one person to another, and from one organ to another, without producing any particular symptoms. So, aging, this is my bad news, but it starts as early as at 30. After 30 years old, our body starts aging. Very slowly in the beginning. It is indiscernible in the beginning. However, as years go by, we have menopause, we have short-sightedness, and there are other pathological, of course, symptoms. And then aging is accelerated for reasons that we're not going to discuss today. They're not part of my talk. So biologically, people age at different pace. In some cases, some age 3 times as fast as others. Now, what is the limit of human survival? What is the maximum number of years we could live? From statistical data, it seems that this limit is, this threshold is at 120 to 125 years. You see here, Miss Calman, she's French. She, on her 122nd birthday, it was broadcasted on TV. Let me also say this. There are various categories of senior citizens. There are old people who, despite their biological age, remain active and in good shape. This grandmother, she's 90, she decided to celebrate her birthday with a parachute jump in free fall. And then this gentleman is 95, he participated to a marathon. And maybe you heard the other day, it was on the papers, that this Japanese lady died at the age of 119. This is to say that age is a multifaceted concept. We have 3 ages. First of all, we have the biological age. This is related to the changes to which our body is subjected as we grow older. The chronological age is the one on our identity card. It is not that related to our biological health, but generally speaking, we know that as this age increases, chances are that we will be suffering from some diseases. And then we have the psychological age, which is related to a very large extent to how one feels. Take an 80-year-old who is active, who goes out, plans for the future, engages in various hobbies and activities, and compare this with someone who's much younger, but who indulges in going to the bar, has no plans, and is looking forward to nothing. You see, aging is, as I said, multifaceted. It's a multi-factor process. Just the biological aging has so many aspects itself. And these are the aspects that we should study more carefully. This is another old lady. She's 91 and she manages a hospital. And the other day, that was on TV, this is the oldest surfer in the world. She lives in Cephalonia in Greece. So we can agree that old people are the healthy ones, the chronic, those who suffer from chronic diseases, and the vulnerable ones. 3 groups. Here you see there are people who have the same age. One is independent, the other one needs help. There are various assessment scales on the basis of which we can rate, we can assess an old person from very fit, an old person who is in good health, good shape, active, etc., up to the terminally ill. Now, geriatrics mainly focus on prevention. What does that mean? Let's see things through different prisms. First of all, prevention of disease, prevention of accidents, prevention of medical related complications. I will explain that later because we have our share of responsibility here. Prevention of psychosocial problems affecting old people. Then a new approach is frailty, and then prevention of aging itself, aging per se. Now, prevention of disease, anasoprophylaxis, chemioprophylaxis, interventions, changes in the way of life, vaccination, dietary habits. Then we have the secondary prevention, dealing with hypertension, diabetes, etc., underlying diseases, that is, in order to improve the health of the person, and interventions, preventive interventions in what we call lifestyle, quitting smoking, taking care of body weight, dietary habits, exercise, exposure to sunlight, etc., etc. Of course, we're not discussing medical issues today, so I will stop here. And by the way, vaccination for coronavirus, from flu, from tetanus, etc., etc., herpes, and so on and so forth. Chapter 2, Prevention against Accidents. There's a Greek proverb that old people die from falls. Well, yes, indeed. This is one of the main causes of death, because a fall usually means fractures, which lead you to the hospital, to complications, etc., etc., with a huge financial, psychological, and other cost. This is a huge difference. See how an old person falls, and how a younger person falls, and how an older person falls. That's why we have hip fractures because of osteoporosis, etc. Also, on the road, while driving, older people are prone to more accidents because of reduced reflexes, worse eyesight, etc. And of course, we have accidents at home when the home is not adapted. For example, taking care of slippery floors, cables, and so on and so forth. Osteoporosis, what does that mean? Look here. This is the bone in its natural state. This is in osteoporosis, and this is when things really get worse. The bone becomes so fragile at an advanced stage. Then, prevention of medicine or medical related complications. Old people, more often than not, suffer from more than one pathologies: hypertension, diabetes, arthropathy, heart diseases, etc. Because of that, they take lots of medicines, and this in turn leads to a different sort of game, so to speak. First, we have the interaction, the overlap between these medicines. Side effects also proliferate, because the more medicines you are prescribed, the more you're exposed to side effects. And then there is another risk, that old people confuse what they have to take, etc., etc. Here, we should also discuss the involvement of multiple specialties: the pulmonologist, the gastroenterologist, the heart doctor, etc. All these look at the patient from a different viewpoint. So it is important that we have the conductor of this orchestra, so to speak, this choir of specialists, because in some cases the individual medicines prescribed may not take into account the prescribed medicines of the other specialty. We also have to prevent hospitalization. The hospital is very bad for old people. Why? Normally we should avoid hospitalization unless there are very serious reasons. All this put together should make doctors, medical doctors, remember this. First of all, that the old patient is a complex case because of the multiple pathologies and comorbidities. And old people may suffer from a serious infection without any fever, for example, because of a variety of disorders. They can hear well, dementia in early stages, etc., etc. Then, reduced reserves in the sense that they can be dehydrated very easily. Their psychokinetic response is slower. The laboratory criteria are different for old people because an old person may have a low creatinine, if we talk about the medical part, without this being strictly related to the GFR indicators. We see that people older than 80 or 85 have, in practice, lost one of their kidneys. We start losing the cells in our kidneys, which means that at that age, we all suffer at that age from kidney deficiency. It is as if in practice we have only one kidney. And all this interacts with the pathological conditions. Now, psychosocial problems. Depression is one problem. Depression in the general population accounts for 2 to 3% according to psychologists. Among old people, depression can reach 50 to 60%. This is a huge percentage. And it is the case for many reasons. Loneliness, for example. We have witnessed loneliness. Remember a case in the 80s, the hot weather in Athens, old people who die, especially abroad, not in Greece, and they were found days later because of the smell outside their door. Why? Because there was no one interested, no one taking care of these people. No one would ask them if they have a problem or not. And then the financial situation, financial resources is a problem for old people because these people have helped their children, have supported them, they have supported the younger generations, and then they are only left with a meager pension. Which brings me to another chapter. I will be very brief here. Of course, we can discuss this later during the debate. Memory disorders. This is another frequent phenomenon in old age. We all know that we tend to forget where we left our keys, our glasses, etc. This is not necessarily dementia. These are two different things. Dementia is a syndrome, is a condition with various symptoms at the same time. It does not solely affect memory. Dementia means a disorder of judgment, of thinking, changes in the mood, in personality, in communication with other people. People suffering from dementia see their relations with others affected. Their daily activities are affected. They are suspicious. They become stingy, very suspicious, as I said, depending, of course, on the personality. Now, the frailty that I mentioned earlier. What is this all about? Some old people give us the impression that they are fine because they're fully functional. However, in reality, they are on the border line of functionality, of what we call good shape. So at the first stress, either psychological or physical, a disease or something, they will immediately collapse. So the old person suffering from frailty suffers from something which is due to the following. A young person has a lot of, so to speak, reserves, and we tend to use only part of these reserves. For example, a young person can go up the 5th floor without running out of breath. An old person will need to use all his reserves to go up to the 2nd floor only. So our reserves wane with time, with old age.
Τώρα δεν είναι το αντικείμενο.
One of the conditions we are exploring is sarcopenia. See how muscle shrinks. This is the muscle of a young person. This is an MRI. This is a slice of the thigh. You see the muscle, and look at the same part of the body on an old person. Muscle is replaced by fat. There are many analyses of this phenomenon. I will not take more of your time on this. I will not dwell in details. But this frailty varies from one individual to another. So vulnerability, sensitivity to stress, etc., all these vary from one individual to another. There are other studies on fail-safe. The University of Patras participated, my university participated from Cyprus, the French university, the Nancy University was also there. So studies have been carried out on all this, including in the context of a European program, Horizon 2020, of anthropoids to act as assistants to old people. And before I conclude, just a couple of things more. Can we prevent aging? Can we address aging? Can we do what we call anti-aging? There's lots of research in this domain. We are studying antioxidants. We're studying reducing the intake of calories, dietary habits, and how they affect the body. It seems some substances help. Resveratrol, citrulline, ribamycin, hormonal replacement, administering estrogens, We are studying how this could help. Of course, there are side effects everywhere. Food supplements. Food supplements can help only those who are not fed properly. And what does that mean? Proper diet for an old person is what Americans say. A multicolor diet. A diet that includes all possible ingredients, proteins, carbohydrates, vegetables, fruits, etc. Because these provide different ingredients that are all needed by our body. And this brings me to the key idea of my presentation, the homes for the aged. Because of the increasing population of old people, we started seeing a proliferation, a mushrooming of such homes. The church owns some of these homes, but also the private sector is moving in this direction. In these homes, old people have a place, of course, where they can eat, sleep. They are supervised from a medical point of view. But these homes also try to make their life more pleasant. Different colors are used, natural lighting, a variety of foods. The staff tries to keep them busy during the day with games, etc., which is good for the brain. They fill their free time. We have programs of physiotherapy in order to provide some exercise. They can also read, they can study if they want, and if they are interested in reading. The whole thing is to make life more pleasant for older people. At this point, and just before concluding, let me say that the World Health Organization has found or has defined that health is a condition of full physical, social well-being of the person. It's about all the aspects of our life. So we have to understand that the effort of this conference is praiseworthy. Because I heard part of the discussion on the rift between science and religion, science and church. Well, I'm not a specialist, I'm not a theologian, I'm not a philosopher, I've got nothing to do with all this. I'm just a layman who is trying to think. And my humble opinion is that there's no reason for any rift, any divergence between church and science. Science deals with the medical part, the physical part of our existence. The church deals with the spiritual aspect of our existence. So we need both. Thank you very much for your patience. I'm at your disposal for questions. Thank you very much.